So, greetings, friends and followers. This is Nurses Talking. I am Dale Barcy. As always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I am very, very pleased to welcome Tona Bobb out of New Jersey, USA. And Tona is a registered nurse. She's a mentor, a quality improvement consultant, a nurse case manager. She's a philanthropist and an advocate. So welcome, Tona.
Thank you, Dale. I am so happy to be here with you today and, be invited to your platform. So,
It is my absolute pleasure, my absolute pleasure. I have wanted to talk to nurses for a long time, and so I'm very happy to be able to do it. But
okay,
first of all,
yes.
what brought you to nursing? What inspired you?
Oh, that's a question that's so common. Um, and I would say for me, I knew I wanted to be in a role where I could help people, bring about their own personal healing.
Hmm.
And that's one aspect of it. But I also knew that I wanted to be in a career where I could be financially independent,
Yeah,
right? That's
yeah.
that was a big one for me, as a young woman choosing a career because I had done jobs. I had been working from a very young age and I felt like, wow, there are certain things I really love doing and there's certain things I know I didn't want to do. And
Hmm.
so it's like I always felt that service was a core component of it. And so for me, it was about not just the service, but bringing healing through service. And so that's pretty much fundamentally what led me to my choice.
Wow, wow, wow. You know, that
Yeah.
that 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 is such a the word that comes to mind, that came to mind as I heard you describing what brought you here was mature. There are many people who say, well, I always wanted to do this since I was a little girl, or I saw my mommy, or I saw you seem to have given it so much thought, and so it seems to resonate it so very deeply with you as you came to it.
Yeah. I tried to get away from it too, but it wouldn't let me go.
You know what? I think that there are very few nurses who have not at some point tried to get away from it and found that it just does not let you go.
Nope.
So how did it challenge you?
Oh, wow. It challenged me in so many ways. In difficult ways, but in also good ways in that allowing me to grow.
Yeah.
So I can definitely say emotional maturity, emotional
Yeah.
intelligence,
Yes.
significant growth in that area.
Hmm.
Um, and just, I mean, aside from the physical stamina that's required, because there's certain areas within nursing. If you take bedside nursing, for example, which I've done for a number of years, not only do you need your physical strength, you need your mental fortitude along with that as well.
Yeah. Yeah.
So yeah, development in that area and realizing the importance of developing myself not only physically but mentally, emotionally, and spiritually.
Spiritually. Hmm.
So I've seen growth in all areas of my life as a result of being in nursing.
Hmm. Yeah. Yeah. It does that. I think we don't even understand when we step into this arena just how much is going to pull out of us and make us see ourselves actually.
Yes. And it's something that we have to ultimately surrender to
Mhm.
in a sense, because, and not surrender to the point of death, but I
Yeah,
mean, surrender to the point of accepting
yeah,
what it is,
yeah,
right? And,
yeah,
and, and the role that we play, not only in the organization that we work for, but in society at large, right? Because just like any medical professional can go anywhere and practice, so can a nurse. A nurse can
Yeah,
go anywhere and practice. And
yeah.
even without identifying one's credentials, you can still find yourself in a nursing role, in a nursing
Yes,
capacity in some
yes,
way or
yes,
form,
yes, yes,
whether
yes.
it's solicited or not, right?
Yes, yes, and that really was one of the reasons I wanted to speak to nurses, because you come to realize that there isn't any area in all of life, actually, and it has to offer. There isn't any area where you cannot function, where those skills don't come into play, and you just say you're a nurse.
Exactly.
You're a
And
nurse.
and 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 to that point, Dale, when you look at nurse innovation and research and development and the
Yes,
expansion that's taken place within the healthcare sector, it goes into wellness, it goes into
yes,
education, it goes into mental health. Um, Many of the things that have been created and developed that impact people globally today have been brought about by the work done by
I
nurses.
nurses. Yes,
Just
absolutely.
identifying a problem and
Mhm.
taking steps to solve it.
Absolutely, absolutely, absolutely. Um, I had no idea. I had no idea. I have to tell you, I had no idea when I entered this profession that it would be so wide-ranging and it would be so impactful. So, what is your current specialty, Tonya? Specialty?
Well, I'm working as a case manager right now in a home
Mm-hmm.
care agency. And so that allows me to diversify a lot of my skills. It's a remote
Mm-hmm.
position, so I don't have to physically go into an office. I don't have to see patients. I can choose to do some of those things, of course. That option is still there, but primarily it's telephonic interaction and pretty much providing a lot of guidance to our non-clinical staff.
Mm-hmm.
So,
Mm-hmm.
I don't have to tell you that there's always a shortage of nurses everywhere. And
Yeah.
I'm not talking about just nurses in numbers. I'm talking about licensed, professional, experienced, level-headed,
Mm-hmm.
conscientious
Mm-hmm.
nurses that are committed to doing the role that they signed up for, right?
Yeah.
Again, not to the point of death, of course. And I have to keep saying that because sometimes we overwork
We
ourselves
do. We
to
do.
our own detriment, right?
Yeah.
But I mean, there various sectors where nurses are perhaps underutilized, but then there are others where the nurses are there, but they're
Hmm.
just not utilized in the way that they really would bring about the most
Mm-hmm.
benefit
Mm-hmm. Mm-hmm.
to the patient population. And so the understaffing looks like, okay, you might take a hospital facility or a long-term care facility and look at those numbers, and there's shortages there, right? And those shortages are there based on the design of those systems. Okay. And so, this is no secret. Patients suffer as a result
Yeah.
of that, right?
Yeah.
Research has proven this time and time again. Um, so, making a choice of where to work, I think, is going to impact the distribution of those numbers that are in the labor
Yeah.
force.
Yeah.
And if we don't see a shift in how the business model is, it's going to most likely become worse.
Yeah. Yeah. Yeah.
And it's already quite bleak.
Yeah.
So that fed into my decision to leave certain roles as well,
Yeah.
for the
Yeah.
preservation of my own health
Of-
and well-being.
Yes. Yes. I can absolutely identify with that. I can absolutely identify with that.
Yeah, yeah. So it's
So,
it's sometimes it's sometimes frustrating, to look at the situation not getting any better, but in other ways it is getting better. In
yeah.
other areas there's improvement and there's progress being made. Um, I would just like to see it more across the board, you know,
Mm,
where
mm-hmm,
where
mm-hmm.
where where the nurse as a servant professional can still take care of the needs of their patients in a way that's humane, in a way that brings peace and comfort, and really helps people on their path to wellness with or without medication, right? Intervention. Because as we know, just popping pills is not all that people need.
It's
There's
not
so much.
even it's not even the biggest thing that people need, actually.
No, it's not at all. It's not at all. But if you know, if we're stripped from our ability to really spend time with people, to really give them the attention and care that they need, then it becomes very minimal. You know, the
Yeah,
impact that we have is very minimal.
it's very, yeah, yeah. It becomes very minimal, it becomes very task oriented and not really very effective. Yeah. So what I was going to ask you, but you started to answer that question actually. I was going to ask you, like, where do you see so many changes have taken place within healthcare and specifically within nursing in the last 5 to 10 years? If you look ahead 5 to 10 years, what do you see?
Wow. You know, for me, that's kind of a challenging question to answer because from what I see, and you know, and seeing takes more than one aspect, more than one perspective,
Mm-hmm.
right? So if you don't mind, I'll share both, right?
Absolutely.
Okay. So on one perspective, I see more involvement from technology
Mm-hmm.
in within nursing, and I'm talking healthcare generally,
Yeah.
but also having its impact on nursing. More infusion of artificial intelligence, which we
Mm-hmm.
see, right? Because
Yeah.
there seems to be an intentionality among industry leaders and those that are in power to decrease the human
The
workforce.
human. Yeah. Mm-hmm.
Okay, right? So, and I don't take that personally. I totally get it. I mean,
Yeah.
they serve a different purpose, right? They're
Yeah.
serving the economic side of
Yeah.
things.
Mm-hmm. Mm-hmm.
So I see that being big. Um and not in a good way. Not in a positive way for the people.
Yeah.
And I say that because from the other perspective, I also see people taking more responsibility for their individual health and well-being.
Mm-hmm.
People taking on more of an ownership of
Yeah.
driving the direction of how they live and the
Yeah.
quality of their life and their children's lives and their families' lives and their communities' lives. So hence we're seeing more women going back to homeopathic,
Mm-hmm.
natural remedies,
Yes.
not taking on the mainstream or the FDA recommendations about what's nutritional, you know,
Yes.
or
Yes.
supplementation and things like that, but shifting back to whole foods, shifting back to unprocessed foods, being more physically active, being more mindful,
Yeah.
having that infiltrate our schools, you know, our educational institutions and things like that. And more nurses and other health professionals taking on those roles as
Those-
well to
Yeah.
be primary care providers who
Yes.
practice the full scope of
The,
health and wellness,
mm-hmm.
you know, specialties wherein people have an alternative to that AI techno driven quote unquote
Yeah.
healthcare
Mm-hmm. Mm-hmm.
that's on the horizon right now. And so that's why I say I see a dual path. You know, you could go either way.
Yeah.
And I'm not saying that one way is better or
Better.
worse. I
Mm-hmm.
mean, I know which way I would choose,
Mm-hmm.
um but
Yeah.
I understand when it's necessary for robotic surgery to get into a very, you know,
Yeah. Yeah.
microscopic area to take care of something that years ago used to be a fully open
Yeah.
procedure where someone would have to spend weeks or a month in a hospital and they can be out in a matter of days. That's
Yeah.
amazing. You know, I love it.
Yeah.
I am so thrilled really to be a part of it right now where I can see all the development and the growth that's happening. But
Yeah.
again, you know, we're at a fork in the road, right? We can go either way. But
Yeah.
we can embrace both.
We can embrace both. So you describe yourself as a mentor.
Yes.
How's that work?
You know, it's really something that I had to identify about myself and kind of put a label to, because it's something that I've been doing since I was in nursing school, since I was a student. You
Mm,
know, I remember in those days we'd have study groups
yeah.
and you know, we'd sit together and discuss things amongst ourselves after lectures and, you know, when we were preparing for exams and things of that nature. And I would have one or two people that would come to me and, you know, oh, could you help me with this? Or I'm not really quite getting this. Maybe you could explain it and try to, you know, say it in a way that's simple, that could break it down so that it doesn't seem so complicated. You know, when you're talking about things like anatomy and physiology and just
Mm-hmm.
just creating little ways of remembering
Mm-hmm.
important things and looking at systems. I always had a way of explaining it that people could understand it and being willing to share that information, right? And so whether I'm working with another nurse or anyone else in the healthcare setting, I've been finding that people rely on the information that I share. You know,
Uh-huh.
people gain clarity from the encounters that they've had with me. And so I feel like for me, it's a growth opportunity as well,
Mm-hmm.
because I'm sharing what I've learned. And it helps me to be innovative for myself in a way where if somebody's really stuck and they have a willingness to understand something that's challenging for them or to get to a point where they have clarity, that I feel very comfortable in being able to help them on that path, you know, to reach their goal or whatever it is they want
Yeah.
better understanding of. And I feel that's essential to mentorship because I differentiate that from preceptoring. You know,
Yeah. Mm-hmm.
there's a concept within nurses of having a preceptor. And one of the things that struck me when I was working in roles where I had preceptors was that not many of them really were very good at it. Um, they really didn't understand what they were supposed to be
What they were.
doing.
Mm-hmm. Mm-hmm.
And many of them did it unwillingly.
Yeah.
And when organizations started offering a little bit of, you know, additional
Reimbursement.
stipend,
Mm-hmm. Mm-hmm.
reimbursement, right? More people were willing to do it for the money, right?
Yeah. Yeah.
But not necessarily for the love of sharing their knowledge. So I always felt like, you know what, whether it's an assignment or whether it's something I'm asked to do, I've always been willing to do it. I'm always been willing to share what I know and to support others, because what does it gain me to withhold knowledge that I have and watch somebody else, you know, go through a challenge that they don't need to? So it's fundamentally something that I've really always been doing, but I just never put a label to it. I just never really put it out there, you know,
Mm.
as a service that people can acquire, right, through reaching out to me. Um, so, and I don't necessarily know if it's something that people really always want to pay for, you know, because there's a lot out there where I guess individuals can engage with mentors and coaches and various professionals that offer different types of assistance
Yeah.
and support, and the price ranges are all over the place.
Yeah.
But I would have to say the most important thing about that is to make sure that it's a good fit,
Yeah.
with the individual that anyone is working with,
Yeah.
right? Do you feel
Yeah.
like you have open communication? Do you feel like it's a person you can trust?
Yeah.
Are you ready to hear the truth, about a certain
That's a big one.
situation, right?
Yeah.
Because, there's many ways that this can be done. And
Yeah.
sometimes the truth is not a comfortable
Yeah.
lesson or information to hear.
Yeah.
It can make us uncomfortable. So, but I'm all about support, right? Because
Yeah.
everybody has to make their own individual choices. Everybody's on their own journey, their own path.
Yeah. Yeah. At a
No,
different
no,
stage on that
yeah,
path. Hmm.
no two are alike.
That's right. That's absolutely right.
So,
Absolutely right.
yeah.
Absolutely right. So you're more than 25 years into this, and you're a mentor and you've worked in different areas. What advice do you think you'd give to someone who now wants to be a nurse?
Uh, I could say a lot of things, but all I could say is be ready to grow up because nursing will force you to grow up
In a hurry.
in a hurry. Yes, it
Yes.
will.
Yes.
If you're very sensitive, you may find yourself challenged.
Yeah. Yeah.
And
Yeah.
I'm not saying that to say that nurses should be abused, right?
No, no. Mhm.
But I'm just saying, like, I'll give you an example. You can work in an environment where you're dealing with patients, and I'm talking about patients because as a nurse, you're dealing with two categories, you're dealing with
Yeah.
multiple categories of
Yeah.
people, right? You're dealing with your patients, you're dealing with an administration, you're dealing with other
Of
healthcare
members of the
professionals on
healthcare
the
team.
team, you're dealing with patients, you're dealing with patients' families, right? I mean, did I leave out anything? It's
And they're
like,
dealing with you.
right. So you're dealing with all of those entities in the work environment. And why I say if you're sensitive, you might want to reconsider that because they're all going to be coming at you
Yeah.
for a piece of you.
Yeah. 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 Yeah.
And can you develop a resolve to say no?
Yeah. Yeah.
You
Exactly.
cannot have a piece of me. I will give you this and no more.
Yeah.
And I
Yeah.
think at some point it gets to that point, it gets to that place because as a nurse starting out, I would try to do so much. I would struggle. I'd be there early, I'd be there working late, I'd be doing everything I possibly can to keep up with what was required of me
And it never seemed
on
to be
any
enough.
given day. It never seemed to be enough. And this is in a
Mhm.
hospital. I've worked in the managed care
Mm.
environment. I've worked in the home care environment. I've worked in the long-term care environment. And none of it has ever been what I would consider
Yeah.
easy.
Yeah.
So
Yeah.
it's kind of like you're in a pick your poison situation.
Yeah,
Um,
it is.
And at the end of the day, you're still going to be having people telling you it's not
It's
enough.
not enough. It's not enough.
So you have to know within yourself that you are enough. Be
Yeah.
willing to give your best, do your best, and when you've reached your limit, that's it.
Walk away. Walk away.
That's it. Time to
Time to
go.
go. Time to go. Time to go. Walk away.
So I mean that's basically what I would have to say. And nursing helps you to learn yourself, right? You may not go in it knowing yourself,
Yeah.
or you might think you know yourself, but when you get into it, the longer you stay in it, you realize just how much more there is to learn
Yes.
about
Yes.
yourself and
About you.
others.
Yes. About you. And
Yeah.
mostly, you said about yourself and others, and that's true, but actually mostly about you.
Mm-hmm.
Mostly about you.
Yeah.
Yeah. So if you had to describe what you see as the most essential quality of a nurse in one word, what would that word be?
Ooh, listening.
Okay. Listening. Yeah,
And I
that's a
don't
good
mean
one.
just listening what's external, listening what's internal.
Yeah, that's a good one. That's a good one. Yeah, listening. Yeah. Yeah. Actually, I think that's the first time that word has come up. And yes, it is absolutely a good one. So before we go, Tonya, would you like to leave us with any special words, any gems?
Wow. The gem that comes to my mind right now, and this would be true for any nurse anywhere on this planet or any other planet, if life exists as we know it,
Yeah,
is that you are enough.
you already know.
You
You
came
are
to
enough.
this world complete, and
Yeah,
don't let anybody make you think otherwise, that you are less than.
yeah, yeah. So often we have to be reminded of that. So often. Yeah. Yeah. So thank you so much for saying that because really it is something that we need to be reminded of fairly often because sometimes people want to make you feel like you're not enough and we buy into that idea that we are not enough and
Oh
that is
yeah,
so not the truth. So not the truth.
not
So
at
thank you for
all.
that.
You're quite welcome.
So thank you, Tonya, for doing this today. I am so pleased and so thankful that you joined me today for this conversation. Thank you so much.
Yes, I am. And I'd love to be back. We can talk about many other things.
I would love to have you back.